Do you have thyroid problem? Are you taking medicines for the same? Does this question bother you also? Do I need to take thyroid medicine? If yes, then stay tuned with me because we are going to discuss the answer of this question in a right and a scientific manner. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Being a hormone expert, and especially when my focus is mainly on the thyroid diseases, I see a lot of patients having a thyroid problem. And many times, the very first question they often ask, Doctor, is this medicine lifelong? Of course, I can understand the difficulty from a patient point of view that it's very difficult to take a pill on a daily basis for lifelong. And we all as a human feel that, do I need to take it? Well, let's dwell more into a scientific knowledge. What is the answer? And possible I might help you in answering your question also. Okay. So, before you ask this question to yourself or your treating doctor, first and foremost, be aware about what kind of a thyroid problem do you have. Very, very important. What happens when you say that I have a thyroid problem? You might come across your family, your friends, or your relatives, your colleagues who say, even I have a thyroid problem. This medicine is for lifelong. And that statement itself is a kind of a demotivating. And people take that statement in their heart that yes, for me also it's going to happen. So first and foremost, don't judge, okay? Understand your own diagnosis because the diagnosis of the other person may not be right for you. So every individual case is different and answer for this question is also different in different scenarios. So first and foremost, get your diagnosis correct. Though we have one thyroid gland in our body, but we don't have only one thyroid problem. The thyroid problems can be of a different categories. I'll tell you a few of them which are more commonly seen in the population. One is a hypothyroidism, where thyroid function is less. Second is hyperthyroidism, where thyroid is working more than required. Third, thyroid is having some kind of inflammation, what we call it as a thyroiditis. You can have a small lump in your gland, that's a thyroid nodule. You can have a whole cancer of the gland, or you can have your entire gland which is swollen up like a goiter. And many more conditions also. So these are the common conditions. So first and foremost, get your diagnosis right. Okay. Once your diagnosis is right, you will be able to get your questions answered in my today's video. And if not, still if you are confused, then write about your medical case in the comment box below. I will try to read them and answer them as early as I can. Okay, and we will publish that also and will help you on that. Okay, so first condition where thyroid medicine is going to be lifelong. Let's discuss on that. Okay, so where the medicine is lifelong, there is no shortcut. You will have to pop this pill every single day. Okay, first one is that after undergoing a thyroid surgery. Yes. See, once you have any thyroid problem and if your doctor has advised you for a thyroid surgery, what they are going to do? They are going to remove a small part or maybe a whole of your thyroid gland. Unfortunately, in our body, we have only one gland. So if that one gland is affected, the hormone production is also going to be affected. So for any reason, if you are undergoing any kind of a thyroid surgery, a part of a thyroid gland is removed and the one which is removed is no more inside your body. So there is no part of your body is going to perform the function what the thyroid gland is doing. That is production of T3 and T4 hormone. In this scenario, you will need a thyroid hormone replacement and this is usually going to be lifelong. I know it is a very major statement and it is a very life-changing situation. And that is the reason why when any patient is advised for the thyroid surgery, that patient thinks 1,000 times. Maybe they also want to take a cross opinion. Okay, so if your doctor has advised you for the thyroid surgery, do check my entire playlist, because I have made an entire series of videos on it. What is thyroidectomy, how it is done, what are the indications, what are the contraindication, what will be your life after surgery, what all precautions you need to take. Whole playlist is there. If you are a candidate who needs to undergo the surgery, please watch that. It will be very helpful to you. So coming back to this video, is that if your thyroid surgery is done, if your hormone production is low after that, you will need a medicine. But what dose, it depends on your blood test and it depends on your individual medical case. If only a part of your thyroid gland was removed, then you might need a smaller dose. But if your entire thyroid gland was removed, then you will need a bigger dose of the medicine. But medicine is of course going to be there, because even after the surgery, your body's demand for the T3 and T4 hormone is not going to decrease. And we will have to supply that to the body in order to make sure that your entire body is functioning well. So in this scenario, medication is lifelong, nothing doing it. And anyone tells you that this will be stopped, I'm sure that person is not completely aware of your medical condition or a science behind it. Okay. Second condition where the medication is going to be lifelong is having a congenital absence. Congenital means from the time a child is born. So when a child is born, if at that time, if the thyroid gland was completely absent, or it is not formed properly, okay, or it is not functioning properly, in such a scenario, we don't have anything called as a thyroid hormone transplant or thyroid gland transplant as of now. So in such situation, of course, you will need a thyroid hormone replacement. Again, this is going to be lifelong and very essential for the child's mental and physical development. So you cannot omit that in this scenario also. Okay, so these are the two conditions where this medication is going to be there. In a very rare scenario, we have seen after the surgery of a thyroid gland, patient does not need a hormone replacement, but very few cases. Okay, you might be lucky if you belong to that category. All right. Now coming to a conditions where the medications can be temporary. Okay, I'm using the word can be temporary. Okay, first is the infertility. Yes, if you are struggling with the fertility and you find that your thyroid hormone is disturbed, in that situation, a doctor might put you on a thyroid hormone replacement. And after having a proper good thyroid functioning, you might be successful and you might have conceived. After the conceiving is done, after the pregnancy is done, once you deliver, there might be a possibility that this medication can be considered to stop. But again, it depends on your medical case. Another condition is the pregnancy. Yes, many times during pregnancy, we find that the woman needs thyroid help. Okay, and at that time, the woman is put on the thyroid hormone replacement. And after the delivery, once the child is born, we have seen few women don't need thyroid hormone replacements later. Okay, but again, it depends on individual medical case. During pregnancy, yes, we definitely advise this medication because we don't want to compromise on the outcome of the pregnancy. You might go through a miscarriage or you might have a child complication. So we don't want all of that, and I'm sure even you don't want that. So in such scenario, we do continue the medication till the pregnancy is over, and after that there is a possibility that the medication may be considered to stop. Okay, again it depends on individual medical case, right? Another condition where you might need a temporary medication is any kind of a short trigger, okay, especially the stress. We all know that stress is not good for our body, and same applies to the thyroid gland also. So if there was a very acute and a major stressful event in your life, and that can lead into the thyroid hormone imbalance, stressful events like separation or a divorce, or having losing any of your family and a loved ones. Okay, so these are the situation where a person goes through a major critical stress and which is unavoidable, and in such situation thyroid hormone can get disturbed and that person may need a medication. After a few months or years, as the stress reduces, once a person adjusts to that situation, once the stress is low, the stress induced thyroid hormone imbalance also goes away, and that situation, yes, this medication can be stopped. Again, depends on your medical case. Another condition is a nutritional deficiency. Yes, see, thyroid hormone is a very, very vital hormone, and vital nutrient for the thyroid hormone is two, iodine and selenium. So if you have a iodine deficiency, this iodine deficiency can cause a decreased thyroid hormone production, and in that scenario you will need a hormone replacement or iodine replacement rather. So if you have a nutritional deficiency, and if you correct those nutritional deficiency, and if that was the reason for you having a thyroid imbalance, if that is corrected, there is a very high possibility that this medication for the hormone replacement will also be stopped. So that's a good news. Okay, so these are the certain scenarios where the hormone replacement can be a temporary and can be considered that you might not need the medicine. Another scenario is any major hormonal fluctuations, especially in a woman. When a woman undergoes through puberty or a pregnancy or a delivery or a menopause, all these four events are a major hormone changes situations. In this scenario, there is a possibility that due to other hormone fluctuation, thyroid disturbance can happen, and once those hormonal fluctuations settles, thyroid problem can also be settled, but again that depends on individual medical case. So these are the common situations where you still have some hope that this medicine will be completely out. Okay, now let's discuss some other and some more common condition where people usually ask this question. In that, the first one is the hypothyroidism. Okay, now hypothyroidism, plain word, means that your thyroid gland is not functioning properly. It is producing less hormones, less T3 and less T4 in your body. So if you have hypothyroidism, then there can be a possibility that you might need a medication. Now again, it depends on what is the cause of the hypothyroidism. Many reasons can be there which can suppress the thyroid hormone production. Okay, and in that, one such and the most commonly seen condition in today's time is the Hashimoto's disease. Hashimoto's disease is a medical term. Okay, it is actually a kind of a autoimmune health problem. Mind you, this problem is not actually of thyroid. The actual problem lies inside your immune system. Your immune system is not functioning well. It is producing antibodies, and it is this antibody which are attacking your thyroid gland. Okay, so if you have a Hashimoto's disease where certain antibodies are there in your body which is attacking, you might need this medicine for a long period of time. Okay, understand, for any problem to solve permanently, we need to reach at the root of that problem, and if we correct those roots, everything else will fall automatically. So similarly, when we talk about the autoimmune condition, it is very difficult as a physician, as a doctor, and even for you as a patient to decide what is actually the root cause, because so many things which is around us can be disturbing to our immune system. In fact, we all are living in a very toxic environment. The food, water, air, everything is toxic. Our environment is so much toxic, and this overload of the toxic chemicals and toxicities, our immune system is not able to fight. And there comes a point where immune system gets so exhausted fighting day in day out to this toxic environment that immune system starts giving up. And that is where these antibodies are created and they start attacking your thyroid gland. It will be of a very big surprise to you that so many things around us is so much toxic. And these toxic things which is disturbing our hormonal system is called as endocrine disruptors. I have made a separate video on endocrine disruptors, and in fact that video is very much eye-opening because you will realize that what all things in and around us, our home, can disturb our own thyroid gland. So do watch that video. You will find the link of that in the description box and on the I button above. Alright. So coming back to Hashimoto's disease, so when you have such kind of a toxic overload which is causing your autoimmune condition, unless and until you are not going to tackle that, you will need a thyroid hormone support. This support is of course not going to work at the Hashimoto's disease root cause. It is just going to work in terms of the giving you a replacement of the hormone which your body is no longer producing. Okay, so in such scenario, the medication is mostly lifelong unless and until you tackle those root causes. Okay. Another condition which we talk is the hyperthyroidism, which is completely different. Okay, hyperthyroidism is a condition where your thyroid gland is working more, so you are having more T3 and more T4 hormone. Now, many times this hyperthyroidism is a temporary. Usually for 1.5 to 2.5 years, a person needs a anti-thyroid medications like carbimazole, methimazole or propylthiouracil. All these medications are going to suppress the thyroid hormone production, and that is usually a temporary. So many times we have seen that the person does not need the medication for more than 1.5 to 2.5 years, and after that a doctor does try to stop the medication. But again, hyperthyroidism can also be due to another autoimmune condition called as a Graves' disease. So if you have a Graves' disease where the root is again like an endocrine disruptor, which I just discussed in hypothyroidism section. So if you are not going to address those roots, there can be a possibility that after stopping these medications, you might relapse back and you will need a hormone medications again in terms to suppress those hormone production. So in such scenario, the temporary medication can be there or it cannot be even there. Okay. Another way of treating a hyperthyroidism is by giving a radioactive iodine therapy. What we call it as a RAI therapy. It is a very famous therapy used for treating hyperthyroidism and it does job beautifully. But the complication of this condition happens is that you will lead into hypothyroidism. So post RAI therapy, if you go into hypothyroidism state, in such scenario, you will need a thyroid hormone replacements. Usually it is a levothyroxine, and this medication is again most likely going to be a lifelong. So you understand which scenario you fit into and then you can answer yourself. Another common condition which is called as a thyroiditis. Thyroiditis means that your thyroid gland is inflamed. Now that inflammation source can be anything. It can be viral also, it can be bacterial also, or any other thing which can inflame your thyroid gland. So if your thyroid gland is temporarily inflamed, so at the temporary inflammation period is going on, you might need a medication, and once the inflammation subsides and it is no longer there, you might not need the medicine. So thyroiditis can also be a condition where the medication can be for a temporary period. Alright. So these are the common conditions which we discussed just now, and so you can ask yourself what condition you have and you can get your questions answered itself. Alright. One important information which I want to tell you, many times nowadays you see a lot of people, doing their courses and webinars. They're just trying to sell such courses to innocent people who have a thyroid problem and claiming that, by doing my course or webinar, you will be getting rid of entire thyroid medication. So if you are going to join such courses, I'm not saying you don't join, okay, but if at all you're going to join such courses, join them with an open mind, because it's very important, because a positive mindset is very, very important. Many times what happens, the person is consuming thyroid pill and with the thought in a mind, oh my god, this is for the lifelong, and the moment you are in that negative zone, that healing which actually it is supposed to bring in your body is not going to happen. So have a positive mindset, very, very important, because if you are not going to have positive mindset, nothing is going to work inside your body. All right. So coming back to such courses and webinars, people do claim all such things. Don't fall for that. If at all you do such courses, you might find that you are finding overall benefit in your body, but may not be 100% true for the stopping of the thyroid medication. Because many times we have seen persons does such courses, pays for them, and when their medicine does not stop, they get very demotivated and they feel very cheated and depressed. Any which way, thyroid people have a high tendency of having depression, and on top of it, when you do this, you go into more depression. And by doing that, you are just taking one pill, now you have to take an antidepressant or anti-psychiatric medication. So it's definitely not worth it. Also, we have seen people have stopped taking their thyroid medication by listening to such claimed webinars and doing such courses, and they have stopped the medicine on their own without consulting their treating doctor. And after the stopping of the medicine, thyroid went completely haywire, imbalance became very severe, they landed up in a complication, their quality of life got damaged. So please don't take so much risk just to stop one pill, okay? Take an informed decision, talk to your treating doctor. I'm sure they are going to help you understand your medical condition in much better way. And if you find that you don't have any such person to talk to, this comment box is there. Please write your comments. I try to read and answer them as early as I can, and I hope to help you. And with this, I'll take your leave, and I hope that you liked the video. If yes, please click on the like button. And if you are new to my channel, don't forget to subscribe so that you get more and more health related information. And my clinic is in Mumbai. Many people have asked me in the comment box, where are you from? Well, I'm from Mumbai, India. And if at all you want to have an online or offline consultation with me, I'm giving you a number of my secretary. You can note down. You can WhatsApp message to her to book your appointment. The number is 9987829999. I'll see you back again in another useful video. Till that time, take care of yourself. Namaste.